This is Dan.
Hello.
I'm here to ask you a couple questions about schizophrenia.
Of course, yeah.
So I'm going to start very quickly. I was wondering, what types of things do you experience in schizophrenia? E.g., like, do you hear voices? Do you see people? Or are you in a completely different
If I wasn't on the medication that I'm on now, it'd be very, very difficult to function. You can have thought disorder, be that your mind's jumping all over the place, you can hardly concentrate. You can also have hallucinations, auditory or visual. You probably have no interest in doing the normal things that people do, like eating at the appropriate times, keeping yourself clean, brushing your teeth, stuff like that. So when you are quite ill, it's like you're just totally out of kilter with the normal human routine. The medication I'm on, I've been on that now for donkeys. I think I started being treated for the disease in about 1996. So over the years I've been on various medication. At the moment I'm on this stuff called clozapine, which you have to have a blood test every month for, to make sure that it's not affecting the white blood cells in your blood. So symptoms while you're on medication, you can have sort of anxiety, restlessness, and then you can have periods of time where I call them like breakthroughs, which you can be okay, and then you'll have sort of strange thoughts, hear voices, and it can be quite unsettling and quite scary at times. But on this medication, it's sparse. It's between, I don't know, maybe a few times a month, so it's sort of manageable. But you can sort of live in a world of fear that you're going to have one of these episodes and it's going to be quite intense. So
when you have voices,
yeah,
what do they tell you? Are they violent? Are they like paranoia voices, or are they just completely random?
It's sort of strange, really, that I've known people that have had voices that are positive, telling them things that sort of give them a lift, and I've also known people that have had voices that have been very, very dark. I think for me, I'd liken it to maybe being in sort of like an abusive relationship. The voices you can hear can be quite negative or quite scary, but with therapy over the years, there's a thing where they teach you how to do it's called positive self-talk. So when you're experiencing these auditory hallucinations, saying horrible things, you can sort of you can sort of with positive self-talk, you can sort of push them out of your mind, if you know what I mean, and sort of rebalance your thinking and stuff.
So do you have a specific example of any auditory hallucination?
Yeah, I can remember, I don't know, was it a week ago? I was cleaning the bathroom, and yeah, it was okay. I was feeling a little bit anxious, a little bit stressed, and I was cleaning away, and it was very clear, the voices. There was two voices in my head, and what it was, how I perceived it in my mind. These two people, they worked for the government in sort of a secret, sort of service type role, and how I was feeling wasn't very good, and it seemed to get more and more intense. And these two chaps, they were saying, "How can you withstand this? How can you withstand this?" And the other chap says, "What level is he at? What level is he at?" And this other chap says he's at level 7. The other voice goes, "Level 7? No one can stand level 7. How come he hasn't?" So what they were on about, how I perceived it, was I was being zapped with this gamma ray or whatever it was, that people that had quite a high sensitivity level could sort of pick up like a receptor. And what they were doing was they were zapping me with this frequency with an aim of making me, break down in tears or have a nervous breakdown. But I was sort of thinking through it at the time. And these two people were like very surprised that I was able to withstand the pressure that they were putting on me through this sort of frequency or sound or whatever it was. So that was quite upsetting. I think it's sort of I don't know, in a way it's like a control element. And in my mind they were doing that to try and break me down or make me have a nervous breakdown or break into tears or whatever, but I was able to sort of stay focused and sort of worked through it, and then gradually the intensity of it all just sort of dissipated and went back to how I was before, so that was quite strange.
So I've heard a lot of different people say they have the same sort of visual hallucinations and it's been documented. Loads of people see like 3D shadowy figures that walk past them, and some people say they talk to them and others say that they are like they're not like distinguishable as like a person, but they're kind of like, I can't explain it because
they've got a presence. Like a presence.
Some people come to them and like speak in very high frequency, like mumbling noises, and others speak. So I was wondering if firstly you have seen these or similar, and do they follow patterns? Like, have you seen them like multiple times or just like once?
It was very strange. I was detained once under the Mental Health Act, and fortunately I've never had to, go back into an institution. At the time I was living in Sheffield, I was going through quite a lot of stress with my relationship. It was before my daughter was born or my wife was pregnant, but I was going through quite a bad time, and the doctors were unsure if I had psychosis or it was schizophrenia. So the idea was I was to come off the medication gradually with a view to seeing the doctor regularly just to see if I could be off medication, I'd be okay. And like I say, I think I was drinking, smoking quite a lot of weed. The relationship was quite rocky at the time. And I was unaware of it, but I'd sort of disappear for periods of time. And my ex-wife would say, "Where have you been? You haven't been here for like 2 days or 2 nights." And I don't know where I was or what I was doing. I was just totally in another place. But the roundabout thing I'm trying to say is I can remember being in a park called Mearsbrook Park, and I just roam around it all night, which is quite a brave thing to do. And I can remember hugging a tree. For some reason I was hugging this tree. And I stuck my face against the trunk of this tree. And then there was like this, it was sort of like a grey shadow, but you could sort of see through it. It was sort of, you could see through it. And it was communicating with me. And it says, "You've nothing to fear." And I said, "Who are you? What are you?" And this entity said, "We've been here before man, and we'll be here after man." They said that they controlled the world. And they control people by manipulation. I don't know if that was through sort of like a telepathic capacity. But yeah, I says, "Oh, I was quite fearful," because it was like, the presence was like no person I've ever met. It was just sort of a really intense feeling. But this voice says, "You've nothing to fear." But I said, I think it just wanted me to know or to be aware that these things existed.
Right.
But no harm came to me. But was I terrified? I don't know. I don't think I was really terrified. It was just sort of an awareness of something greater than people, really. It's bizarre.
And this entity, did you see it? Was it like in front of you? What did it look like? Was it human shaped? Like what was it?
It was sort of like probably like human shaped, but like sort of distorted. There was no facial features or fingers and toes and things like that, but it was sort of a presence.
Humanoid.
Well, yeah, in probably the same sort of proportions as a person, head, torso, legs and arms, but it wasn't clear like I'm sat here, you're sat there. It was sort of there, but it wasn't at the same time.
And what colour was this? Was it like black?
I think it's like sort of black and sort of, I don't know if there's like dark greys and black sort of mixed.
Do you know it's a hallucination, or does it feel like perfectly real? Or is it kind of like mixed? You don't really.
Yeah, it's very strange. It's very strange. I mean, my daughter was asking me about it years ago, and I can remember she was saying that she'd been really high and it was crazy because she didn't know who she was or where she was. So I sort of said to her, yeah, it's funny, but I says, if you went to bed and woke up the next day and you're the same and the same the day after and the day after, that's when it's not fun. That's when you've got real issues. But I think getting ill, you don't notice you are getting ill. It's a very, very gradual thing, and it seems to affect a lot of aspects in your life. It's not just like one thing that's really weird and everything else is as it should be. You sort of shift into this, it's not another dimension, it's sort of like an ulterior reality really. But no, it's very subtle. I mean, I don't know if that's the case for everybody. I don't know if it's the case, some people it's quite hard and fast, but no, it was very gradual, and it's sometimes other people notice it, and that's the worrying thing. Yourself, you could be batshit crazy and feel totally normal, and there'll be someone that knew you and they'll be like quite concerned. So yeah, it's you don't always have insight, although I have insight to know to take my medication so that I don't go ape shit and go in hospital, but some people don't have that.
So just for this question, I want a yes or no. I don't want a.
Okay.
I don't want. Or if it's like difficult to say yes or no, then you can mention that. So, have any voices or beings, or anything, told you information that you deem impossible, like to know, or like very like information that like they couldn't know, or even about someone else, or something that's like not.
Or something that's happened to you in the past that they know
or
about.
Happened to somebody else and is like kind of like, imagine that was another person talking to you. That would have been impossible.
Yeah. Trying to think, really.
Like, no, yes, maybe.
No, I don't think so.
Yeah,
I don't think so. Don't think so. Like, I've never had I've never heard something and it would say something that maybe one or two people ever knew about. But no, I wouldn't say so. No.
Specifically auditory, but I mean it could be linked to something visually. Do they ever get angry at certain things or louder when you do a certain thing?
In the past,
in the past it's been
a bit like
probably
being
being
in
in
I like
it
to being in a domestic what's the word when you're in a
Domestic abuse?
No,
like domestic abuse, sometimes
the voice can change from sort of like an internal murmur to sort of quite an aggressive voice, but I haven't really struggled with that for a long time. Usually the voices are just sort of like we're talking now, it's not sort of aggressive and threatening usually.
And you're 100% sure when you hear these voices that they are something else, you like know the distinction?
Yeah, well, it's like as a person, if you just sit here and you think, I'm going to go and make a cup of tea, you actually say that, but you can sort of sense that in your mind. And how that feels with the voices, it feels as natural as your internal voice, but it is not your internal voice, it's something on about something or talking about something that's totally irrelevant. Like you think to yourself, right, I need to get up, get dressed, do this. That feels very natural, that's like your internal voice. Whereas the voices, they feel as natural as your inner voice, but they're not your thoughts and feelings.
Right, so you just have this feeling that you know, like, was it ever difficult at one point to discern that?
Oh, I don't know. That's a good question. I know the older I've got, you get more of a handle on yourself and the symptoms. I think maybe when you're younger, it's probably more scary and more overwhelming. But I think with the right medication and like try and look after your mental health, don't use drugs and stuff, you can sort of get on by. But I think it's quite terrifying when you're young because you've never experienced it before, so it's quite overwhelming.
So this might be only linked to like super severe cases.
Yeah.
But it's been documented that people are having conversations with a voice.
Yeah.
Like not just having things pop in their head of do this, they're having conversations as if something's talking to them with a voice over multiple days.
Yeah.
Has that ever happened?
Probably when I was very ill.
Very.
Probably when I was very ill. But yeah, I mean, I've known people that sort of talk to themselves. You know, they'll mutter to themselves as if they're responding to a conversation that nobody else can hear because it's inside the head. But no, not really. No. I think a lot of the time, when you're going through that period, and you're sort of having auditory hallucinations, a lot of the time you're sort of battling it in your mind. You know, your own voice is battling against these sort of negative voices. But
So it is a battle.
yeah, it can be. Yeah. I mean, visual hallucinations. I can't remember the last time I had a visual hallucination, but I can remember when I was detained in hospital, the voices would sort of tell you to do things, and said if you didn't do those things, something bad was going to happen to you. But that's a long time ago. So it might say, go out of the room, go to your dormitory, take your jumper off, turn it inside out, and put it back on. And you'd think, well, what am I going to do that for? And then the voice would like be aggressive and threaten you, if you don't do this, something bad's going to happen. So I've experienced that, but that was many years ago.
Right. This is a very short one. Has there been any voices or auditory things that aren't like human and just don't make any sense? Like you just...
Well, like a foreign language almost.
Yeah, foreign language or just like some like sort of like, yeah, you know what I mean, just a sound.
No, I don't think so.
No?
Well, it's quite interesting, you know, you hear these people that go to church and they end up speaking in tongues even though it's a language they don't really know. I just don't know if they're just talking rubbish or actually there's some truth in it, but no, not really.
Has there ever been indications of voices or people that aren't hallucinations?
What, you mean real people?
Yeah, that you wouldn't like...
Yeah,
How do I put this?
there's you can have an element of paranoia. I mean, the condition I've got is paranoid schizophrenic. So, sometimes, you know, if you're sort of out and about, if someone made, say, a negative comment, maybe not directed at you, sometimes you can sort of personalise things. Like, you can be scanning when you're out and about, especially in busy places. You're sort of overly aware. And I think sometimes you can pick up on words or sentences and you can sort of, in your mind, it's sort of directed at you when it probably isn't, but that's the aspect of the paranoia. So
Do they ever come as intrusive thoughts?
intrusive thoughts, yeah, intrusive thoughts, yeah, it's you do get that. I'm trying to think of some examples of intrusive thoughts. Sort of telling you what to do, really, sometimes. This is it. Sometimes it can be quite hard to pull it from your mind to talk about it, because it's sort of, you experience it, but putting it into words sometimes can be difficult. But I'm trying to think of any intrusive thoughts I've had recently. Well, there were sort of intrusive thoughts about the invisible frequency thing. That sort of, I've classed that as like an intrusive thought. Because I wouldn't want to have that thought at all, but it's sort of...
I meant like thought. Yeah, like
put the kettle on and pour it over your head or something like
just
that.
something random, like you see a kid and it's like, go punch that kid over there.
No,
or,
not
"Oh,
really.
punch that kid," or you see someone that's like, they hate me, or
I
"They're gonna
think
get me."
I think it depends how well or unwell the person is. I think if you were quite unwell, you'd probably have more symptoms and more likely to act them out than somebody that was sort of medicated and fairly balanced. Like I say, a lot of the horrific things that happen, a lot of the time they can be, people with schizophrenia, paranoid schizophrenia, but they're probably not healthy and looking after themselves, and that's why these things happen.
Do they ask you to make any offerings in return for something? You already said about this when they were telling you to do this or something bad would happen, but were they ever saying like, do this for us and we'll get you this sort of thing?
Not really, no. No, it was sort of silly little things. It wasn't saying, go out and... Although, yeah, to be fair, thinking back, when I was an inpatient for a period of time, I was very ill. I think my ex-wife even slept with a knife under her bed because she thought I was quite scary, which doesn't sound great now, but anyway. So yeah, I was I went into hospital and they wanted me to stay voluntarily, but I didn't want to be there. So they detained me under the Mental Health Act because I was unwell. And I can remember being on the ward. There's some bloke, I've never met him before in my life, but the voices in my head were saying that he was like an evil entity and I had to give him a kick in. So I followed the instructions, went up to this lad, booted him up the arse, and he turned round and he was very frightening. So I think the staff got intervened. They moved me to another ward because he was being followed around so that he wouldn't rip my head off. And I can remember I sat down in this sort of waiting room area, and I think they stopped following him around on level 1 observations. He had like a table knife in his pocket and he pulled it out, came right into my face, held this knife about, I don't know, 2 inches away from my eye. Sort of says, you ever piss me off again, I'll take your eyes or whatever. So I sort of sat there going, okay. And then this big burly support worker jumped in, grabbed his arm, took the knife away and escorted him off. So yeah, but yeah, when you're quite ill, intrusive voices are not always your friend. They can get you in a lot of shit, I think, to be fair.
Yeah. Is it rare that they're positive?
Especially
when you're ill?
Yeah, there's a guy I knew, I hadn't seen him for quite a while, and he was saying that his consultant was worried about him and he couldn't understand why. He said he was having voices, but they weren't negative or nasty. They were all quite positive, saying good things about it. Yeah, I don't know. I'd say the intensity and the amount of control the voices had on me was more when I was very ill. Whereas as of late, it's sort of they're a pain in the arse, but they haven't got the full power over me that they probably would have done when I was acutely ill.
Is there anything the voices of the entity specifically liked or disliked?
I don't know really. It's very sporadic. People said to me, what was the trigger for this or what was the trigger for that? And I said, to be fair, I couldn't really say if there was a trigger. It just sort of occurs, it just sort of 1 minute it's there, then next minute it's not. I think you've got to look after yourself and sort of not put yourself in situations that could be very stressful and cause you to feel distress. So. But no, it's strange. It's sort of, there doesn't seem to be a trigger. It just seems to pop up every now and again. It's sort of weird.
So I think this might be the last question. Do you or did the entity or whatever hate the medications?
No, not at all. Not at all. I've never been one of these people. I've worked in mental health many years ago, and I've come across a lot of people that have got psychiatric conditions, and they call them revolving doors. The patients, they are acutely ill. They go into hospital. They get them healthy, get the weight back up, looking after their own personal self-care, and they're doing okay. They discharge them. They come out of hospital, there's nobody monitoring them and making sure that they're looking after themselves. And then over a period of time they deteriorate, and then they end up being back in hospital. So they call that a revolving door. But no, for me, the meds I'm on, they're not great, you know, weight gain, and there's a lot of sort of health issues that can cause. But
Like, do they cause blurred vision? Or did they when you first got
I think so, yeah, they can cause blurred vision. It's sort of physiologically, it's not good for your liver and your kidneys and stuff like that. But no, the meds, it's never been an issue. I've known if I didn't take my meds, then I'd probably end up being quite ill and in the hospital. So it's sort of a bitter pill, but there you go, you've got to take it.
I've got two last questions actually.
Okay.
The first one is, what is the worst case of psychosis or schizophrenia you've seen in somebody else?
In somebody else, there was a guy when I was in Chesterfield. He came in, had a middle-aged man. He had a dressing over his throat. I thought, in my deluded state, I thought he'd been attacked by a vampire, which sounds really stupid, but at the time it seemed quite realistic. But yeah, I think he tried to take his own life. I don't know if he'd hacked away at his neck and his throat, but he had like a dressing on. And I can remember he was in the smoking room with a support worker, and the bandage dropped down from his throat, and all these huge lesions in his throat, and it was, yeah, quite bad.
Yeah, I've heard of stories of that, and it ties into my last question, which is, do you think that it's possible that these entities talking to people and seeing people could actually be real entities, like they're demons rather than just pure hallucinations?
I don't know. I think sort of modern medicine in the Western world, it's all sort of chemical imbalances or, you know, brain damage and stuff like that, whereas there are a lot of places like Africa and stuff where I don't think they actually believe in mental illness. They believe that it's sort of it's more of a sort of spiritual invasion rather than you know, chemical imbalance as such. But yeah.
So, thank you for doing the interview with me.
No, thank you. It's been great.
I appreciate that.
Thank you.